Welcome to Case Study Lecture. In this session, we will explore the case study on PTSD. I'm Ms. Soumya R., Assistant Professor from the Department of Psychology, Dr. S.N.S. Rajalakshmi College of Arts and Science. Case studies are the valuable research method used to investigate and analyze complex issues in various fields such as businesses, psychology, medicine, and more. Throughout this lecture, we will cover the structure of typical case study on PTSD and we will give the conclusions. Today's case is about Mr. A. Mr. A is a 24-year-old man and was an infantryman with a local Marine Reserve unit who was honorably discharged in 2014 after serving 2 hours of duty in Iraq. His fiancée has told him he has not been the same since his second tour of duty and it is impacting their relationship. Although he offers few details upon questioning, he reports that he has significant difficulty sleeping and that he has sleeps with one eye open and on the occasions when he falls into deeper sleep, he has nightmares. He endorses experiencing several traumatic events during his second tour but is unwilling to provide specific details. He tells you he has never spoken with anyone about them and he is not sure he ever will. He spends much of his time alone because he feels irritable and does not want to snap at the people. He reports to you that he finds it difficult to perform his duties as a security guard because it is boring and gives him too much time to think. At the same time, he is easily startled by a noise and motion and spends excessive time searching for threats that are never confirmed both when on duty and at home. He describes having intrusive memories about his traumatic experiences on daily basis, but he declines to share any details. He also provides various signals like he is avoiding seeing friends from his reserve unit because seeing them reminds him of experiences that he does not want to remember. From this case study, we can infer that there are so many symptoms like hypervigilance, intrusive thoughts, and irritability, and loss of interest, sleep difficulties like due to nightmares, and traumatic experience can have been seen through this case. Based on the case study and based on the symptoms, we could diagnose that person Mr. A is suffering from post-traumatic stress disorder. Post-traumatic stress disorder is once called a shell shock or a battle fatigue syndrome is a serious condition that can develop after a person has experienced or witnessed a traumatic or terrifying event in which there is serious physical harm or threat. PTSD is a lasting consequence of traumatic ordeals that causes intense fear, helplessness, or horror. Examples of things that can bring on PTSD include sexual or physical assault, the unexpected death of a loved one, an accident, war, or a natural disaster. Families of victims can develop PTSD, as can emergency personnel and rescue workers. Most of the people who have traumatic event will have reactions that may include shock, anger, nervousness, fear, and even guilt. These reactions are common and for most people they go away over time. For the person with PTSD, however, these feelings continue and even increase, becoming so strong that they keep the person from going about their life as expected. People with PTSD have symptoms for longer than 1 month and can function as well as before the event that triggered it happened. Treatment for PTSD is usually centering around talk therapy, psychotherapy, particularly cognitive behavioral therapy, has proven to be one of the most reliable treatments for PTSD. It consists of several parts like exposure therapy, stress inhalation training, and training a cognitive reappraisal. One major goal is to restore cognitive flexibility so that sufferers can talk about their bad experiences, modifying the emotional force of the memory. Underlying such improvements are increases in nerve cell connectivity, a hallmark of all effective therapies. New forms of treatment are under the development that combine talk therapy and medication in innovative ways for the 50% of sufferers whose symptoms are not revived by current strategies. Some most of the promising new approaches involve psychedelic drugs, psychedelic assisted psychotherapy. Psychedelic drugs are being tried under controlled conditions to boost the power of psychotherapy. Taken under the guidance of trained psychotherapists, such as drugs are helping patients process the distresses, emotions associated with their traumatic experiences so that they are no longer constantly on the outlook for and hyper reactive to signs of dangers. Treatment also consists of drugs like anesthetic ketamine, sometimes known as club drug special K. It is already approved for the use in treating severe depression when given by injection in concert with a specific program of psychotherapy. It has been shown to significantly speed recovery from PTSD, accomplishing in days what might otherwise take months. Also under the study of for such use in MDMA, also known as ecstasy or Molly, when given for PTSD patients just before a therapy session, researchers find it dramatically speeds up the therapeutic processes. It allows even those with chronic PTSD to talk about deeply disturbing events and regain control of their reactivity. Psychedelics like MDMA, also known as ecstasy and Molly, can help patients with PTSD reconsolidate traumatic memories. PTSD sufferers experiencing unpredictable flashbacks to the traumatic event and often relive the same stress, fear, and other negative emotions as if they are happening in real time. Given in combination with therapy, psychedelics help patients to get the emotional distance from their traumatic memories that they need in order to process them and heal. Trauma-informed therapists recognize the signs of PTSD and focus on treating the whole person. They understand that someone experiences particularly traumatic ones can affect their entire lives, increasing their risk of physical and mental health issues. Trauma-informed therapists apply their knowledge of trauma and its effects in treating patients with eye to avoid re-traumatization. However, trauma experts caution not to fall for the myth of trauma-informed care. Not all the individuals who have experienced trauma develop PTSD, and PTSD is not necessarily the main causal factor in future problems such as incarceration, poverty and joblessness and homelessness. Thanks a lot for watching.